In Living Well today, it's about balancing the needs of the sandwich generation. I'm like a lot of people. I've got younger kids at home, and I also have an aging mother-in-law living with me as well. What do you do with your adult members of your family if they can't be home while you're away at work or the kids are at school? Well, that's where Sarah Care comes in.
Yeah.
We're here at Sarah Care with Kendra Shoemaker. What is this place?
Sarah Care is a medical model adult day center, and what we do here at Sarah Care is basic nursing home level of care, but we do it in a day setting. So we allow working family members like yourself to carry on with the duties that you need to perform, like working and going to soccer games and getting groceries, while still taking the responsibility and caring for your loved one at home.
So this is like, it's a daycare center for adults.
Right, except that we're not just a daycare center. We're a medical model adult day, which means that we have a nurse on staff, and we can do that basic nursing home level of care, including bathing and incontinence care.
And also medications?
Absolutely, yep.
And like a nursing home, you have to provide meals, and that nutrition is really an important part of this.
Right. Many of our participants are diabetic, so we make sure that the food that we serve is diabetically proportioned. Not that we never have a treat like the pumpkin pies you're seeing on the counter, because that is a special treat for us here today. But on a regular basis, we do not offer dessert type.
Okay. And what you do, too, is you have a nurse on staff who can help care for the physical needs.
Right. Yep. We have a nurse on staff full-time to not only to do the medications, but also to monitor the care needs that our participants have. And our nurse is frequently in communication with the physicians of the participants that come to our center.
Okay, so we went from the dining room, and now we're here in the activity center, where you have a lot of things that go on during the day.
Yep. This is our main activity center, and what you'll see here after lunch especially is that we do our group activities, and we like to make sure that we include physical activity, activities that promote cognitive thinking, as well as socialization. So we do things ranging from arts and crafts to pet therapy to intergenerational therapy, and then a range of motion to make sure that people that have movement in their limbs can maintain what they have or hopefully improve it.
And you have therapists who come in that are skilled at helping people.
Yep. Grand Rapids Home Health is a contract agency. They come in with their physical therapists. They also have occupational therapists and speech therapists, which is very important for our participants who have had strokes, as they often have difficulty swallowing. So that's where the speech therapy comes in.
And the goal here is what?
Keeping families together. How to provide care for your loved one at home, yet continue with your daily obligations, continue to do what you need to do throughout the day, but yet have a part in caregiving. We're finding that families really want to be involved in that.
And it's a way to keep families together.
That's right.
A great way, a great model to help care for your older members of your family as we deal with this issue of the sandwich generation in the 21st century. You know, and this is something that I found, it's one of those great necessities that certain families will have. Sarah Care is part of the Metro Health Village. They're open Monday through Friday from 7 in the morning until 6 o'clock in the evening, and then Saturdays from 9 to 5. And the information is so nice because, I mean, it really is like an adult daycare, but because they are a medical model, full-service facility, they can dispense medication, they can give medical care when necessary, they have a nutritionist on staff. It's a wonderful option for families like ours. Our goal is to make sure that my mother-in-law stays in our home until, you know, until the very last, when she maybe can't anymore.
Right.
But if you don't have the facilities, you don't have enough support staff at home to keep them there, Sarah Care offers a wonderful option.
And good also because I know sometimes a lot of people have lost a spouse, so it's just nice to be able to go somewhere and be able to interact with other people.
Have some companionship.
That maybe that there's some things in common, and to be able to feel like you're not so isolated.
Yeah. So anyway, Sarah Care, it's really a great facility.